Now, we've learned a bit about Omicron in the last couple of weeks since it was first sequenced, but a lot remains unknown. It certainly seems more transmissible than Delta, which means it will more easily spread among our population. We're already seeing that as more and more states pop up sequencing the new variant. Now, this makes masking, distancing, and ventilation more relevant than ever. As for severity, there's been some initial reports that it may be less severe than Delta. Now, it's important to remember that these reports are based on looking at the number of infections in South Africa as compared to the number of hospitalizations in South Africa. How many people infected are getting hospitalized? Now, this data is preliminary, and importantly, the demographics of South Africa skew much younger than the United States. And with a much larger young population, you'd expect more mild disease. So we'll continue to observe what happens in other countries to get a better idea of severity. We don't want to yet jump to any assumptions. As for immune evasion, there is preliminary evidence, but it's pretty compelling evidence that past infection may not be as protective with Omicron as with other variants. And we still await more information on vaccine effectiveness, but judging from past variants we've seen, we would expect vaccine protection, perhaps with some erosion. That is to say, we may get not quite as great a level of protection, but still quite good protection. So we'll certainly continue to watch news on Omicron and hope for a lower severity disease than Delta with a high level of vaccine effectiveness. That would be our best case scenario, a variant that could provide some immune protection without severe disease, but it's just too early to say. In the meantime, we have to continue our high level of caution around Delta. That means vaccine, COVID vaccine, also influenza vaccine. That means COVID boosters. And that means masking, distancing, and ventilating whenever we're indoors in public.